We are here to give a broadcast and a little bit of an introduction and some information about some of the safe practices that the state is expecting from our construction industry as we deal with this COVID pandemic. Before we start, let me just say thank you to everyone in the construction industry. We will be putting out a document fairly soon about the unemployment rate for the state of New Mexico. As many of you know, the Workforce Solutions Department runs the unemployment office, and one of the only bright spots in the economy is our construction industry, where 700 jobs in the state were actually added in the month of June. So thank you all very, very much for the work you're doing. It is appreciated. The infrastructure that you are building for the state will benefit all of our friends and neighbors for years and decades on out, and you are very appreciated, and thank you for all your work. Before I get started on the presentation, I'd like to add one more thing. Jay, Clay, and I, three very easy names, Bill, Jay, and Clay, will be answering your questions. We want to take about half an hour of your time to give a presentation and then leave some time for questions. If you have a question, you should be able to enter it into the chat feature on this web presentation. Please put who you are, where you represent, what company you represent or what employer you represent, and what your question is. And Stacy Johnson, who's our public information officer, will read those questions and we'll answer as many of those as we possibly can. If we cannot answer a question, luckily we'll be recording it in the chat presentation and we will try to get you an answer as soon as we can. So Stacy, if we're ready to start, let's get this thing moving. Stacy, can we go to the next slide? Thank you. So some of the state agencies and some of the vernacular moving forward, as I said, OSHA stands for Occupational Safety and Health Administration. They enforce workplace safety and the health regulations, and the Environment Department has taken the lead on the specific regulation of workplaces and making sure they're safe in the state. The Department of Health and their epidemiologists are setting a lot of the guidelines for health standards as we move forward with the COVID situation. There are state experts on that. Our department, the Department of Workforce Solutions, participates in workforce training, and we do work placement as well. We are also running the unemployment shop for the state, which has been one of our main areas of emphasis over the past few months. And the construction industry divisions of regulation and licensing, they're responsible for enforcing and licensing specific construction regulations. And Jay will be talking, as I said earlier, from OSHA, and Clay will be talking from CID. Next slide, please. So what are some of the COVID safe practices we were asking for all employers in the state of New Mexico, not just in construction? First of all, if there's any possibility of people doing remote work, accounting, HR, any kind of payroll, we are encouraging that as much as possible. Secondly, for anybody in any workplace, as you've probably heard by now, the 6 foot of distance between everybody is very, very important. So for instance, in our workplace, we are not allowing people to be pretty much in break rooms or congregating in hallways. We're trying to keep 6 feet of distance. When we have to sit down together, we make sure there's 2 or 3 chairs spaced between us. That sort of thing is important. Make sure that if you can, once again, close your common areas. Please make sure there's no break rooms open. If people need to take a break, have them do so in open spaces where they can physically distance themselves from one another. Have remote meetings when possible. I know many of you are out on the work site, but when you have to have meetings with planners, managers, supervisors, see if you can do those remotely through web presentations like this one. And make sure all of your employees have face coverings. Wearing a mask is one of the most important things we can do to stop the spread of COVID. And I know it's hot outside, and I know these things can be a little annoying to wear all the time, but as an example, the federal government just did a study basically showing that there was actually a COVID positive person in a salon in Missouri. They wore a mask. All of their customers wore masks, and not one person actually got infected. So the masks and wearing those face coverings is one of the most important things we can do. We encourage people to wear them anytime they're in a situation where they're next to anybody, inside or outside. Next slide, please. Continuing on this, what are some of the other requirements? Please work to train your employees on daily cleaning. Sanitizing their tools and their workspace is really, really important. How can hand washing and sanitizer be supported where you're at? I know sometimes you're out on the job site, washing facilities isn't as common, make sure that everyone's got some hand sanitizer around, because making sure your hands are disinfected, if you happen to touch your face, that's the best way of stopping the spread. The use of gloves is not a substitute. Sometimes you touch something with gloves and put them on your face as well. So hand washing and sanitization is really important. If you've had close contact with someone with COVID, don't let them come to work. Please have them go get tested at the Department of Health and keep them separated until they get a negative test. The contact tracing strategy, where we find out the positive people and then quarantine them, is one of the best ways we have of slowing the spread of COVID here in New Mexico. If you have someone sick or they know they've been in contact with someone, please keep them home. Minimize non-essential travel. I know that some of you all have essential workers coming in terms of bringing supplies or doing inspections, that sort of thing. But if there's any way that we can keep meetings remote, that is the most important thing that we can do in this regard. Travel and people going from one place to the other is one of the biggest ways that this thing spreads. And once again, please try to adhere to all the CDC and OSHA guidelines. Next slide, please. If you can, please screen your employees when they check in for the day. If they've got any of these symptoms, especially in the environment we are in today, there is a much higher risk that they have COVID. So please take this opportunity to look at all these symptoms, the fever, the cough, the shortness of breath. And if any of your employees are experiencing that, please ask them to go home, get tested, and quarantine until they get their test results back. Next slide, please. Once again, some recommended best practices for employers. So those are the requirements. Here's some of the recommendations that folks have come up with to help us do this better. What kind of communication plan can you put in to make sure that everybody knows the rules about hand washing, social distancing, masks, etc.? Can you have a team or a leader in your workplace that is responsible for making sure this communication happens? Can you make sure that vulnerable workers, so I'll be talking about them later, but specifically older workers over the age of 65, have the opportunity to work without people? Can they work from home? Can they be in a separate part of the office? That sort of thing. Can you retain a daily log? And I'm sure you do this a lot of times when you're checking people in for pay, of all the folks that are coming into your workspace, your workers and possibly customers, so that if there is a positive test, we can do that contact tracing. And once again, if you've got an indoor place, can you make sure your HVAC systems are maintained to make sure that there's an opportunity to get that virus out of your workspace? Next slide, please. Specifically for construction industries, make sure that people have PPE, specifically face masks, when they're dealing with other people. Can you put up signage on your property, on your primary job site, to make sure that everybody knows about the rules regarding masking, social distancing, hand hygiene, etc.? Can you prevent non-essential visitors? Can you really have a discussion and say, okay, who really needs to be on the job site and who can we deal with remotely? If the answer is we can deal with them remotely, please deal with them remotely. Only necessary personnel should enter the work site and supply trailers or job site office areas to make sure we're slowing the spread here. And if you can arrange for contactless delivery, if someone can come, drop off something to a delivery site, go away, then you pick it up, that's the best way to do delivery of supplies. Next slide, please. Continuing on this, can you screen employees and visitors as we came in? Once again, if you have the opportunity to get a temperature of people coming in, if they've got a fever, they should go away because there's a high likelihood they could have COVID. Can you stagger your work schedules and your arrival departure times to make sure that not everybody is congregating around a time clock and those other types of issues to, once again, make sure we've got social distancing guidelines that are followed? Can we make sure we divide our crews into groups? And that's really important for you all to be able to continue your jobs. Because if someone is testing positive and they have interacted with everybody else on your job site, there's a good chance that the health department is going to ask everyone to stay home. So if you can divide people into crews that don't interact with each other, and we do have to quarantine a certain portion of your workers, the rest of them can continue to work. And can you encourage the crews at their own space and time to minimize ride sharing and other possible places where they interact? I know this is hard. I know people are generally social creatures. During break time, during rides, we like to talk to one another. We're going to talk about the ball game the night before on the way to work. We're going to talk about so-and-so's girlfriend or boyfriend, that sort of thing. That's what we do as people. But if you can ask people to stay minimally in contact with one another, it's going to help us move forward. Next slide, please. Additionally, for all your tools and equipment, can you not share them? Can people be designated for a specific piece of equipment and always know that when they turn that back in, please recommend them that they sanitize it and give them training on how to do so. And then please follow those activities within occupied buildings. Make sure that you are talking about specific hazards when determining best practices, right? Employees should be asking occupants to keep personal distance. Our building, the Tiwa building in downtown Albuquerque, is currently under construction with year out. And we are asking people when they come in and out to make sure they maintain social distancing with the folks that are in our building for the safety of everybody. And once again, wash your hands, wash your hands, wash your hands when you start and complete a work. And once again, always wear a face mask. Next slide, please. So I'm going to leave this up here. I'm not going to go too into it, but if you have under 500 employees for your business, if some of your employees are asked to quarantine, then they should be given 2 weeks of paid sick leave according to the Families First Coronavirus Act that was passed and signed by the president in March. This is a federal act. And if you want to follow the directions at the bottom, there are actually specific guidelines on how you can get a tax credit that will allow you to get reimbursed for the payment of sick leave. But the long and short of this is, if you have under 500 employees and you're not a medical provider, and I don't think anybody here is, it is federal law that 2 weeks of paid sick leave for people that are either tested positive or asked to quarantine because they were around people that were tested positive be given according to this law. Next slide, please. Okay, this is important. So for folks that are high risk of getting COVID, and this is from the state health department, we are giving good cause to keep receiving unemployment to everyone who could be in these specific categories. So anybody over the age of 65, automatically considered high risk. If they need to leave their work, they'll be given unemployment because they shouldn't be going back to work. And then if other people in these categories can provide documentation from a medical provider that they've had lung disease, they've got serious asthma, serious heart conditions, etc. These are the medical provisions that are put you at high risk if you do get COVID of getting seriously ill from it. These folks should not be coming to work. Next slide, please. Okay, if you have an employee that you're asking to come back to work and they're on unemployment, and you are offering them the same employment opportunities that they had before COVID, they're not supposed to stay on unemployment. They're supposed to come back to work. And you can print out this form here. Actually, I don't think I have to print it out. It is a PDF that you can fill it online and email it to our office at the Workforce Solutions Department to make sure that we have an investigation. And if your folks can't say that there's a good cause, so they can't say that, hey, look, my employer was not following COVID safe practices. They can't prove that there was an abusive situation going on with a supervisor or whatever. Then they're not supposed to be getting unemployment. They need to prove that there is what we call good cause if they voluntarily leave a job or refuse a job that is offered to them. You can't also say, hey, look, I'm making more on unemployment than I am at my work. That's not good cause. And you can't just say I'm generally scared of COVID-19. You have to provide a really good reason why you shouldn't be going to work. Next slide, please. The message we're trying to say here, and I'll be done in a minute, is that there's a joint responsibility between the worker and the employer. A worker should be going back to work if the employer is following public health orders and they get a good job offer that is equivalent to maybe what they had before COVID or what they had even during COVID, because I know you guys are actually staying open. However, the employer has to really provide a safe work site and establish a plan for public health. These are the responsibilities we're asking from everybody in the state to allow us to continue to move our economy forward and keep these construction projects that are so important to us moving along. Next slide, please. So this is just, if anybody is interested, the New Mexico Tourism Department is actually having a series of trainings and help getting supplies and other types of services through the New Mexico Safe Certified Program. And if you as an employer are interested in these trainings and these services, please look at this website that the Tourism Department is putting forward and see if you're interested in going through that process. It's actually really good. It was originally just for tourist type jobs, and they've expanded it to all employers in New Mexico. And the next couple of slides, I'll just go forward, Stacey. These are some places you can get your PPPE resources. The New Mexico Association of Commerce and Industry has been very active in working with employers to find masks, gloves, sanitary stuff for your hands, thermometers, that sort of thing. And you can contact Janae at their office at the information below. And then the next slide, New Mexico Tech University is actually heading up another group that is assisting employers in getting the supplies that they need to move forward with a safe workplace. And once again, this is going to be recorded and put on YouTube. So if we're going through this kind of fast, understand that you can always come back and watch it and get all the information from these slides in the future. Next slide, please. Okay, so before we go to questions, I'd like to see if I missed anything. I know Jay Stimmel from OSHA, who has been doing a lot of work in the construction industry, would like to take a few minutes to give you some more points. Then we'll go to Clay Bailey with Construction Industries Division. Jay?
Okay, good afternoon, everybody. I work for New Mexico OSHA. I'm a compliance assistant specialist. So my primary job function is working with construction companies. And I've been visiting construction sites since the pandemic started on an ongoing basis. And there's some things I see and repeatedly, and it's been a slow process to learn. Construction industry they never stopped for the most part. They've continued to operate. They had to learn how to deal with the COVID virus on the fly. So it's something that they've never dealt with before. There's some common things that can, simple things that can keep you safe. And it's been a steep learning curve. And it's a cultural change. As the cabinet secretary mentioned earlier, you got to keep distance from those folks that you've worked with, you spend a lot of your time with again and again. And to keep that distance is difficult. But I've seen learning curves and sites that I've visited repeatedly, again and again, and people are slowly learning. There is changing. It's a difficult thing to do. So, but let's just talk about it. One of the big things I see is people think, no, it's no big deal. It's not going to happen on my site. Some of those people who said that have had positive tests on their sites. As of yesterday, there's 15,341 COVID-19 cases in New Mexico. That's just slightly less than 1% of the people. So 1 out of every 100 people in New Mexico has contacted the COVID virus. Of that, there's been 557 deaths. So that means about 1 out of every 33 people that gets it has died. So it's real, it's there, and it's not going to go away for a while. So, the simple things that can keep you safe that I see not happening on a lot of job sites, or other sites have learned it now. One of there's confusion about social distancing and masks. As the cabinet secretary said, masks do keep you safe. They keep you safer, but they don't give you absolute protection. You should never violate that 6-foot distance from somebody else unless you have to do work with them, and then minimize your time there. Get the job done, separate. Don't stay there talking after you completed a task, separate again. That should be your minimum distance. That mask doesn't protect you completely and inside that distance. There's an old rule that we use for contamination. You double the distance, and it's 1/4 the concentration, the chance of catching it. You quadruple it, and there's 1/16 of the chance. So the further you are away, the more safer you are. So don't keep that 6 feet as a minimum distance, like I said, unless the job requires it, and then separate. I see too many people finishing the task they do, and then they stay there and, okay, how's your wife? How are the kids? Just step back a few feet. You really reduce the further back you go, you really reduce your chance of catching it. The mask primarily protect a person who has it from spreading it. Think of you blow your nose, you use a handkerchief, it stops it from spreading. And that's a social etiquette thing we've done forever. That's what that mask is doing. It's containing it within the person, spreading it to the other people nearby. Blow your nose sometimes and it's not as good as a respirator that people use, but for, those are being kept for the healthcare professionals, and even those don't work completely. People have probably heard of N95 respirator. Well, that keeps 95% of it out, but 5% still has a possibility of getting in. So, and I see people with masks pulling it down below their nose. Well, you breathe out through your nose. It's not as bad as your mouth, but it does, stuff still comes out your nose. And then I see other people down on their chin. You don't need to protect your chin. I can guarantee it. So you need to cover your mouth and your nose for it to be successful. So, and now I'll tell you something that I've been having to tell a lot of people. The construction companies have learned to wear masks, but now they need to unlearn some of that and learn when not to wear masks. I see people operating heavy equipment. Nobody can get even close to 6 feet from them without putting themselves at risk. But I see these operators wearing masks, and they're getting overheated. We're hitting the hot part of the summer. It's 90. It's hitting the upper 80s, low 90s in Santa Fe, the mid to upper 90s in Albuquerque, and the 100. It's crossing 110 scale down south. So when you don't need to wear a mask, don't wear it. You can be concerned. The present hazards that's on every job site right now is the heat stress. So, but let me, put some caveat on that. But when you stop being protected, when you stop with that heavy equipment, you get off and put that mask back on. When you approach somebody that's, they've parked their thing, their piece of heavy equipment, let them know you're coming so they have a chance to put that mask back on. Make sure when you put the mask on that it's on correctly. Don't do this to put the mask on. I see too many people do this again and again, putting a mask up. Your hands are the most likely way you're going to be infected. And I'm going to get to hand washing next, but you got to watch that. It only harms you if it gets inside of you. The route that gets inside of you determines some of the way that it'll affect you. If you eat food that you contaminate with your hands, somebody else contaminate your food with your hands. It doesn't have a long life in food, but if it's been handled, that's the way you can get in. It gets into your stomach that way. If you breathe it in by getting your hands close to your face, and I clean my hands, so I washed my hands before I came in here, it'll get into your lungs. The other thing is through an open wound. If you have an open wound that's unprotected, it'll get in your bloodstream. It manifests itself in a lot of different ways. You saw on one of the slides all the way that it can affect you, all the effects it can have on you, all the symptoms. So you want to keep it out of your body, and the mask prevents. The secondary precaution with the mask, it keeps your hands away from touching your face all the time. But like I said, if you're readjusting the mask all the time, it kind of defeats that purpose. So let's cleaning your hands. The best thing out there that actually destroys the virus pretty quickly is soap and water. We're having a major problem with theft on job sites of people stealing the disinfectants that are portable potties. Some of the construction companies have cameras on their sites, and they've told me it looks like normal people just coming on their job site to go into the porta potties and carrying out the disinfectants inside. Hand cleaners, they're disappearing too from sites. What one company's done, it's worked out pretty well. They gave each of their employees a small container that is it's a good container. It's very durable, and they refill it. They have before they go out in the morning and leave the job sites, they have a container that they can refill their little bottle, and then it lasts for over a day, and nobody's stealing that. Okay. So it's covered face cleaning, hand cleaning, the heat stress, be aware of that. The other people that are working, there's a lot of people. I came across a gentleman, he was old. He was, almost my age. So that's old. He was working alone by himself. He was about 50 yards from anywhere else, and it was a very hot day. It was probably about 105 degrees. He was working in the full sun, so it was much warmer than 105 degrees that day. And he was wearing some heavy equipment, and he was doing some finish work, and there was nobody going to be coming near him. He was wearing a mask, and I could see he was overheating. And the first thing I did was ask him to take a break and get in the shade. So you got to be aware of that heat stress. It's another thing, like I said, it's present on all the job sites. The other thing I've seen, welders welding by themselves, because people can't often be near a welder because they're striking an arc. There's danger to your eyes, so they wear a hood. And I've seen them standing out there by themselves welding and wearing a face mask underneath their hood. They're wearing very hot equipment, fire-resistant clothing, leathers to keep their clothes from catching on fire, and they're putting themselves at risk. So, but like I said, once again, when people approach the person is working, don't tap them on the shoulder and have them turn around and be right in your breathing zone, and you and theirs. So let them know that you're there. So assume it's a 6-foot bubble around them, and stay at that 6-foot bubble and tell them, hey, Joe, I'm here. if you want to put your mask on, you should. It's kind of the thing to put your mask on when you're that close. Okay, moving along. Drinking water. We really don't want people to have the old large containers of drinking water where everybody's touching it. Because that's cross-contaminating everything touch. We don't want people, we like people to wash their hands before they go to the bathroom and after they go to the bathroom, because otherwise they contaminate the inside of the bathroom, the porta potty or whatever, because then the next person along gets contaminated and they cross-contaminate. So wash your hands before and after, so that you don't make it contaminated and protect yourself from those that do. I sat out at a job site one day watching people go to the bathroom. I was in the vehicle doing a windshield tour, and I saw more than 3/4 of people didn't wash their hands before. There was a washing station there with soap and water. They didn't wash their hands before or after the bathroom. They just walked down, touched the surface, used the bathroom, and left it again. So to reinforce some other things, getting to a job site, the optimal way to get a job site is one person per vehicle. Whether it's it's a local site that you're using your personal car to get there, or you're using a company truck vehicle to get there, one person per vehicle. If it goes beyond one person per vehicle, separate as much as you can from each other. What I've suggested to people now, if you're putting 2 people in a vehicle and it's got a king cab, put one in the driver's seat and one in the opposite corner in the back, and give that person in the back something to do. Give them something to read, something to listen to, some kind of distraction so they don't talk. We ask that they refrain from talking as much as possible during that. So that, having another guy's distraction. Same people, same vehicles, same driver and passenger in there, and keep that so you're not cross-contaminating. As the director said, play the Russian spy. The FBI had trouble in the 60s keeping all the Russian spies because each cell was onto its own. If you work, don't interact with people you don't have to. Don't cross-contamination so you don't shut down a whole job site. One crew going away is a big difference, 4 or 5 people from a job site with over 100 people. So I want to wrap this up. And finally, if you're sick, don't come to work. Stay at home, because as soon as you come to the job site and they see you have something, they're telling you, you got to move on and go home. You've already contaminated some people. You've already probably stopped to talk to some people. So if you're sick, take your temperature before you leave. If it's over 100.4 degrees, call in and stay home. So I thank you for your patience. If you have any questions, feel free to contact me at the health at OSHA, the New Mexico OSHA. Thank you for the time, Mr. Director.
Thank you very much, sir. Clay, do you have anything you want to add from CID?
Yes, sir. Thank you, Cabinet Secretary. As I said, my name is Clay Bailey. I'm with CID. We're in charge of licensing, plan review, permitting, inspections, along with compliance and education. You guys have covered nearly everything. The only 2 things I would really add, we've been very proud that construction was deemed essential in the beginning, and we've had our employees out there the whole time. We've had anywhere between 55 and 65 inspectors out every day of the week, except the weekends, in this stuff. And we've, so far to date, I'm proud to say we haven't had any positive. And I believe that's from the PPE. We enforce it. We communicate with our employees, and we show them by leading by example. It's important. They see me wear it, they wear it. And the only thing I'd like to touch on that y'all haven't covered that I have seen in our world is that the close encounters and calls I've had, they haven't got it from the work site as of yet. We're on heightened alert. We go out to work these sites. We know it could possibly be there, so we're wearing our PPE. The instances I've had trouble and found is when our individuals, our inspectors, or our employees go back home and they start mixing with other family members from other states, or not even other states, but other areas. And that is where I've had my close calls of having to put people out for the 2 weeks or something. So we're really aware of it when we're at the job site, but when we're not at the job site, we sometimes let our guard down. And I would, at least if I was an employer, let my employees to be aware of that and really be concerned with that. Thank you, sir.
Thank you, Clay. I appreciate that. So that is our presentation regarding kind of the general situation and what we're asking folks to do. I know we had 1 or 2 questions. Stacy, would you like to read questions? And then if anybody does have a question, there is a chat box that you can type your question into, and Stacy will read it to us. And once again, we'll try our best to answer it. And if we can't get an answer, we'll do our best to find something and get back to you on it. So Stacy, you want to start?
Sure. So the first question is, has there been an increase in COVID positive cases in the construction industry?
I can answer that one.
Please.
Yes, there has. There's been a huge uptake. We're actually doubling our size of our bureau to handle all the positive cases that are coming in. And I've noticed an increase in, over the last few years, been escalating week after week. And I deal with a number of those, and I deal with the companies, and it's increasing. It's on an upswing. And the nice thing about it is the response from the companies has been pretty good. They've isolated employees, made sure they're not coming to work, not sure they're spreading it. So the response, there's been uptake, but the way they've handled it is done well. They've done well.
Thank you. The next question is, if an employee has been exposed and is forced to stay at home for 2 weeks, then comes back to work and is exposed again, will the employer have to cover the additional 2 weeks under FMLA or pay that themselves?
Right. So it's not FMLA, it's the Families First Coronavirus Act. And I would like to say that I did have a conversation with someone from the Department of Labor last week about this, and their direction is that you get one shot at this. You get one shot at the 2 weeks of sick leave. Afterwards, and I believe that came from Ms. Rodriguez, we're going to have to try to figure out whether at unemployment that person would be eligible for unemployment because they might have good cause. So if you have someone who is asked to quarantine a second time, I would have them get in touch with our office. And this is the first time I've seen this question, and we'll have to have a discussion about that. I imagine we would probably lean towards giving them the unemployment because we don't want them going back to work, but that we want them to have some support. But they would also have to, some of the issues we've had with unemployment is that some folks just sometimes don't want to go back to work. And so we would really need documentation from the Department of Health that they were asked to stay home and quarantine. So Ms. Rodriguez, I hope that answers your question. I'm gonna put my email address in the chat, and if you have specific questions regarding this, you can feel free to email me and we'll work it out.
Perfect.
Go ahead, Stacey.
And then another question that kind of goes hand in hand with what you just said, Secretary, is you mentioned that if someone has had exposure to a known positive person and are asked to quarantine by their employer for that reason, they should be paid per the FFCRA. However, I can't find this in written federal, state, or local government quarantine order. Can you please clarify this or advise where I can find something in writing on this to cover us should we be audited for this somewhere down the road?
Yeah, I think there's one thing in there that I would like to correct if I can, which is people aren't being asked to quarantine by the employer. They're being asked to quarantine by the Department of Health. And if that order comes through the employer, then that's fine, but it needs to come from the Department of Health initially. And that is what I believe the public health order says for the state of New Mexico as we move forward with these regulations. The Families First Coronavirus Act, the Department of Labor has explained to us, follows the state guidelines. And so it is up to the Department of Health to make that determination. If you have to give it, that's fine on behalf of the department, but that's where it comes from.
And then the last question we have here, and if anyone else would like to pose a question, please put that in the Q&A below. The last question is, how do we access this video on YouTube if it's blocked on state computers?
I think every department has their own rules regarding that. I'm actually allowed to watch YouTube on our department's computers.
Yes.
I would ask, this I think was also to help for the private sector, but I would find a way to watch this on YouTube through a different means.
That concludes the questions for now.
Okay. Is there anybody else with a question regarding the construction regulations that we can try to answer for you now? Okay, seeing none. If anybody has a specific question, or Ms. Rodriguez, if you would like some clarification on yours, I have typed my email into the chat. You can feel free to email me and we will get back to you with as much information as we can. Thank you everybody very much for taking the time to get on this call. I hope it was informative. It will be available, as I said, by YouTube. And if you know of anybody that would like to watch this, we will be distributing it through an email to folks at AGC, ABC, and the building trades, as well as the machinists. Ms. Erickson, I just saw your chat. My email is bill, B-I-L-L, .mccamley, M-C-C-A-M-L-E-Y, at state.nm.us, and you can feel free to email me with questions. Stacy, did we get one more question there? I saw one about
it looks like we have one. Sure. So since we know eventually we all will get this and flattening the curve is the goal, what is the acceptable number of infections before we get back to normal?
Okay, I would actually like to respectfully disagree with that statement. I don't think we all should get this. And around the country and around the world, you're seeing places that have asked their folks to wear masks. They've done social distancing. They've been able to flatten the curve, and they've been able to keep the spread of the virus really minimal. And that's not only important for the folks that would be directly affected by COVID, but it's important for our hospitals and healthcare workers. You know, when this thing just started, I was talking with some union folks, construction guys actually, who were really worried. They say, I want to work. And I said, fellas, I get you. But what you saw in Italy, you saw in New York, and what you're seeing right now in places as close as Phoenix and El Paso is their hospitals are being overloaded with COVID patients. They're running out of medical personnel, and in some cases, they're running out of beds. What that means is if you hurt yourself in a non-COVID manner and you go to the hospital, let's say you're on a ladder, you fall down, you break your rib and you puncture your lung. If you go to the hospital, it's going to be tough for people to find medical personnel and beds for you to be at. So this isn't just about COVID per se. It's also about making sure that we're protecting all of our folks moving forward. And if we do these things, if we wear masks, if we socially distance, we can actually stop the spread, and there is no guarantee that everybody's going to get this.
I actually have a few more questions, Secretary. If an employee chooses to take vacation, does the employer have to pay for the quarantine?
Yeah, so we actually got this question. It's a very good question. I see the other one on there is about workers deciding to go to 4th of July parties. If someone tests positive, they're going to be asked to quarantine. I will say, though, that we've gotten some questions about if a worker chooses to go to, say, Arizona or Texas and comes back and they go there for a vacation or a birthday party or whatever. We are in the process of getting clarification on that right now. I can tell you what my opinion is on that, but we're working with the governor's office to try to get some clarification, and we'll hopefully have that soon. It's a fair question, and we're going to work on getting an answer.
Okay. I'm a HVAC subcontractor with an office having 9 to 14 workers in separate offices. No customers enter our premises, and social distancing is rigorously practiced. Does the governor's order require our office employees while working in this environment to wear face masks?
So what we're doing in our environment is basically saying if you are in your own office environment and your own area, you can take the mask off. Anytime, however, you go into a public place where you may come within 6 feet of one another, or you're in any kind of environment where you're in a meeting room or a bathroom or walking inside and outside of the office, we are asking face masks to be worn. That's how we're working on that, and that is the advice we're giving other folks too. If you're in your own office, there's a closed door, you're not within 6 feet of anybody else, you can probably take it off. Once you get into a public area, we're going to have that interaction. Remember, this is all about interaction. Please, please, please constantly remember to put the masks on.
Looks like that was our last question.
Okay. Well, once again, Jay, Clay, do you have anything else you guys want to add before we're done here?
No, just take heed to what we said today and be safe out there. And think of not only yourself, not just yourself, think of your family, your coworkers, your friends, and your community. And like Clay said earlier, it's 24/7 that the exposure exists. Don't forget it when you leave the workplace. Take some of that safety home with you.
Jay?
No, sir. Yeah, I think we covered it. Thank you.
Okay. Hey, Stacy, did I see we got one more quick question?
Yes, it says, how dangerous is a shared HVAC system in an office?
Yeah, I think we're still trying to figure that out. I think there's a lot of very, very smart people that are really doing progress and research on this thing, and obviously our knowledge evolves as we move forward. I do know that as part of our regulations, and you would have seen this in the slide deck that I presented, one of the recommendations that we make to folks is that you constantly have your HVAC system maintained, and if you have filters, make sure that they're clean to keep the air as clean as possible.
Can I interject? I'm sorry.
Please. Yes, sir.
Moving air is life. The exposures are reduced by moving air as opposed to stagnant air. So it's good to have the HVAC systems working because that keeps that air moving. When it becomes stagnant, it's more likely to contaminate people coming through it.
Okay, thank you. Are there any last questions? Every time we say that, we seem to get one more. Okay, seeing none, once again, everybody, thank you so much for attending this presentation. Jay and Clay, really appreciate you taking the time out of your day to give us some more information and answer questions. Thanks, everybody. Have a great afternoon. Please stay safe, stay healthy, and let's all keep moving forward together. Thank you, everybody.
Thank you.
Yes, thank you.